A health advocate who recently started her own business, Doc in Your Corner, Danielle Savage is here to speak with me today. As a PCP MD for 10 years, she has experience navigating the medical care maze and helps others decipher medical jargon and advocate for proper care in a complex medical system. Danielle also helps the sandwich generation care for parents who may be living far away and need an advocate by their side virtually when they see a doctor. Danielle, thanks for chatting with me today.
Thank you so much for having me. It's a pleasure to be here.
Well, right back at you. So please tell us, what is a health advocate?
Yeah, that's a great question. I think, simply put, a health advocate is about empowering individuals to navigate this incredibly complex healthcare system that we have. It's really about ensuring that individuals' voices are heard, that you understand your health conditions, you understand all your options for treatment, and that you're making the most informed decisions that you can about your health that align with your personal values. Um, Many advocates come from nursing or social work backgrounds, but as a physician, I like to think I bring a bit of a unique understanding of the medical system from the inside, which can really help in bridging communication gaps and breaking down really complex information into simply put language.
And what pulled you into this niche in your career?
Yeah, I think my journey to health advocacy really grew out of two things. One is my decade as a primary care doctor, and two, my personal experiences. So, in my practice, I consistently saw older patients with multiple medical conditions, complex medication lists, potentially even some cognitive changes, just falling through the cracks of the medical system. And oftentimes through no fault of their doctors, and no fault of their families, just their adult children or family members, part of this, so-called sandwich generation, just had their own lives, simply couldn't be there to advocate for them because they were taking care of their own families. They had their own careers. But it's it was very difficult for these patients to take what they heard at all their different specialist visits and remember it and follow through. And they were just often falling through the cracks of the medical system. That was pretty heartbreaking to witness on a regular basis. On a more personal level, my in-laws in the past couple of years faced some serious illnesses and naturally found myself acting as their advocate, using my medical knowledge to simplify things for the family, to ensure that everyone was on the same page and understood the choices, so that they would have good outcomes. And I realized how incredibly difficult this can be for people without a medical background, without any medical knowledge, because it's really like speaking a foreign language. So these experiences combined with discovering another physician advocate on a podcast I was listening to actually showed me that I could really turn this passion for advocacy into a full-time service. And it just felt like the perfect alignment of my skills, and it really fulfills a critical need in our system.
Absolutely. The need, it must be huge. I just,
Yeah.
I can't believe that we don't have in a high school curriculum, something that teaches people about insurance, because it's part of all of our lives eventually. We have to go to a
Yeah.
doctor's appointment. We end up, in the hospital for this or that. We have procedures. It's a part of all
Yeah.
of our lives, yet there isn't education on it. I mean, what
Yeah.
have you seen change in recent years, both from the standpoint of just the logistics of going through the medical care maze and also how society has or hasn't learned along with it?
I think what has changed, I mean, things have become incredibly specialized in our country, which is fantastic. You have a lot of specialists who have very niche areas of knowledge, and so you get incredible expertise when you go to specialists. But that does fracture care quite a bit, and so people end up going from specialist to specialist to specialist, without anyone really talking. Similarly, insurance companies have a very heavy hand in care, and often deny procedures, deny treatments, and they do this really without talking to the patient, and the patient doesn't know where to turn. So things become very fractured. Communication is really poor. And even though we have great medical experts and great medical care, communication is really a lost art in medicine, and things feel very rushed for patients, and it becomes incredibly difficult to navigate the system. And I think that's where things have begun changing and fracturing. Um, Advocates are starting to become a little bit more mainstream. It's a bit of a newer profession, and not many people know about it. But because of how complex things have become, and because of how difficult communication has become, I think that advocacy is starting to become more widely known and more widely utilized.
And you mentioned a bit about working with the sandwich generation, caring for elderly parents. Can you tell us a little bit more about, I guess we'd say, the logistics of that? Like, what's the step by step that someone works with you in that process?
Yeah, so I mean, the best way that someone can reach out to me is through my website or my email. So docinyourcorner.com has a specific, um, you know, clickable button for booking an initial consultation, or you can email me directly at dsavage@docinyourcorner.com. And basically, we would set up an initial 20 to 30 minute consultation, not giving any advocacy services during that time. I'm not giving any advice, but really I'm there to hear your story. And it's a chance to share your situation. What's been overwhelming to you? What's been, your particular pain points in your journey or your family member's journey? Then I just listen and figure out how I might be able to help you, lay out a plan for how I might be able to help you, and see if we're a good fit. If that's the case and we decide to move forward, um, it's very unique to each individual patient how I can help. But in terms of that sandwich generation and a more long-term relationship with patients who need consistent help. I can help with education, so translating complex diagnoses, medication lists, translate your test results into plain English so you can really understand what's going on with yourself or your family member, which is really important in order to make good decisions. I can help you with documentation, so organizing, especially in elderly parents, medication history, allergy list, medical history, surgical history into a document that you can easily hand to providers so that everyone is on the same page, everyone has the same information. I can virtually attend appointments by phone to ensure that no crucial details are missed, document what was said during the appointment, and then brief the family about that afterwards. Can look into second opinions, alternative treatments, clinical trials, and just basically ensure that questions get asked and answered during appointments. I can help bridge communication gaps between patients' multiple specialists and between family members as well. Take that information back to the family so that the family is aware of what's going on, aware of the plan, and is kind of all on the same page and able to make decisions together.
Wow, that's huge. That's huge. It kind of blows my mind that this is a relatively new career, because it sounds like something that almost should just be a part of our medical system. I mean, I know there's a lot of things lacking, but just to be able to have someone like you in, as you say, in your corner to walk through all of this.
Yeah, it really should be more widely available. And I think it will be. I know that Medicare just added some reimbursement codes to actually reimburse for advocacy services. So I think it's going to start becoming more mainstream. But really, I think advocacy is a product of how complex our medical system has become and how fractured it has become. Like I said, despite having all these amazing specialists and niche areas where people are experts in medical care, it just becomes very broken, and there's a lack of communication, and that's where the advocacy can come in and sort of fill that gap.
Where do you see this going? You mentioned that there's some reimbursements starting. Do you see that becoming more common? Do you see, insurance companies starting to bring on advocates or medical systems? What do you see as the next steps?
I think it is going to start becoming a bit more mainstream now that Medicare has added these reimbursement codes. A lot of times when Medicare does something, other insurance companies follow suit. So I think it will start to become more widely available. I think that the tricky part with insurance reimbursement is that you're kind of under the thumb of the insurance company, and you have to go by their requirements, whether they have time requirements, if they need to approve the advocacy work that you do. It does put a bit of a constraint on the advocate in that way, but it does make it more widely available. So I can't complain about that.
What is one thing you would tell our audience to just help bring down the overwhelm when it comes to navigating all of this? Whether they're on their own, working with someone, advocating for a family member. Is there something just kind of straightforward that is a step in the right direction to bringing down that overwhelm?
Yeah, I think the number one thing is don't suffer in silence and don't feel like you have to navigate it all alone. It's okay to ask for help, whether that is from an advocate or if it's from a family member or a close friend. Just confiding in someone about what's been going on can make an enormous difference and can ease some of that burden. But I would say by identifying the most pressing pain point. Is it understanding a diagnosis? Is it managing your medication? Is it getting your doctors to talk to each other? And then I would seek support for that one specific challenge first. Just start with the most pressing thing first, and even a small step can lead to significant relief.
And when people are in an appointment, do you have any advice for making the most of it and getting the clarity that's needed?
I would say the most important thing is write down your questions beforehand, which I know a lot of patients do already, but some don't know that they can do that or that they can ask questions. Don't be afraid to ask questions. If you have them all written down beforehand, that ensures that you don't forget them. And then bring a journal and write the answers down. You should feel like a partner in your medical team and an active participant in your health, not just a subject to your medical team. So if you don't feel like you can be an active participant and like you can ask questions and ask your doctor to repeat or explain something differently, then it may be time to think about who you want as a part of your medical team and if this is the right fit for you, because you should really feel like you can be an active participant that has the ability to decide for themselves.
That's really great advice, Danielle. And I really love how you said being a partner in your medical care. That's
Yeah.
so important for us to just really keep in the front of our mind. Danielle,
Totally.
thank you so much for chatting, for sharing these insights. And again, that's Doc in Your Corner online. And thank you for all the good you're doing.
Thank you. I'm so happy to be here.
Thanks for tuning in to A Dose of Health, part of Healthy in the Garden State. For more, check out healthyinthegardenstate.com. Here's to living our healthiest self in New Jersey.